A ganglion cyst is a fluid-filled swelling that typically forms near a joint or tendon. They are thought to develop from a protrusion of connective tissue, joint capsule, bursae, or meniscus. This is why they are noncancerous and contain gelatinous fluid. Ganglion cysts are generally round or oval-shaped and are commonly found on the dorsal side of the wrist and hand, although they can also appear in other areas of the body, such as the foot or ankle. Ganglion cysts are relatively common and can occur at any age, but they tend to be more prevalent in individuals between the age of 15 and 40, with a slight female predominance. While ganglion cysts are typically harmless, they can sometimes cause discomfort and pain, especially if they compress nerves and tendons. Pressure on the nerve may also result in a tingling or numb sensation in the affected area. If the cyst is located near a joint, it can restrict movement or cause stiffness. Ganglion cysts may vary in size. They can increase or decrease in size spontaneously or in response to activities that exert pressure on the affected area. This size variation is more noticeable in larger joints. The initial step in diagnosing a ganglion cyst is to perform a physical examination, assessing the size, location, and shape of the cyst. Transillumination, which is a technique that involves shining a light through the cyst, can be used to differentiate ganglia from solid tumors easily. In some cases, ultrasonography and MRI may be recommended to rule out other conditions and obtain a better view of the cyst. The primary approach to treatment is to begin with non-surgical interventions. Patients with painless cysts require no treatment, and observation over time is sufficient to evaluate any potential changes. Over 50% of patients experience resolution with no specific intervention. Physical activity can cause a ganglion cyst to grow. Therefore, a brace or a splint can be temporarily used to immobilize the joint. This might aid in shrinking the ganglion and relieving pressure on the nerves. However, it's important to note that long-term use of a brace may weaken the muscles. In cases where bothersome symptoms are present, aspiration of the cyst may be performed. Unfortunately, over half of the ganglions treated with aspiration will recur within approximately 1 year. Surgery is considered the final option when other treatments have proven ineffective. Surgical treatment is recommended for patients with persistent or recurrent symptoms. The surgery involves the removal of the entire cyst and the stalk that attaches it to the surrounding tissues.